Thank you so much for that introduction, Corinne. I am very, very excited to be here tonight, doing a little presentation for everyone. Like was said before, my name is Dr. Regan. I'm a plastic surgeon at Modern Aesthetic Plastic Surgery currently. We have 2 locations, one in Newtown in Bucks County and one in King of Prussia. I'm very excited to be presenting on non-surgical options for facial feminization tonight. This is a great topic to go over. Just kind of get the dirty stuff out of the way. I don't have any disclosures for this presentation tonight, but I will be discussing some off-label uses for some injectable products that are amazing for what we're going to be talking about tonight. We already kind of went over my bio, so I can skip over this slide quickly. What we're going to be talking about tonight is a lot of important stuff. In residency, we usually break these down into week-long seminars. So we're going to kind of pull everything together tonight for our presentation. I wanted to kind of touch base on what makes a feminine face. So we're going to go through kind of the anatomical structures in the face that are going to make a more feminized look and kind of augment that beauty. Of course, talking about proportions is very important when we talk about facial anatomy. But of course, the rest of the bulk of the discussion is going to be talking about treatments. That includes chemodenervation, which is a really fancy word for Botox, volumization, depilation, which is laser hair removal, maintaining strong hair in where we want hair, of course, and then doing some mini lifting in the face using threading, talking about refining our neck with some neck sculpting, and lastly, and most importantly, some skincare. So we'll jump right into our facial anatomy. Plastic surgeons have really developed the core structure of what makes beautiful faces. And we've clearly defined what makes feminine anatomy in the face feminine and masculine anatomy masculine. These are kind of the prominent things that when we're looking at a patient, we're looking for femininity. Of course, there are other little minor variations in the face that are going to kind of brighten up the face for even more enhancements, but these are kind of the big areas when we're talking about a feminine face. We're talking about a shorter forehead length, which usually is talking about a lower hairline. We're talking about a vertical forehead instead of an angled forehead. We're looking for a nice rounded hairline, not something that's square or very peaked. We're looking for a higher angled brow position that sits above the brow bone. And usually that brow bone is nice and soft. Positive canthal tilt, also, which means basically the eyes move upwards. They kind of slant upwards as they go out to the side. We're looking for a finer nose that's more refined and with a nice little upturn to it. Prominent cheekbones, both in the apple of the cheek as well as in that blush area along the cheekbone. A shorter philtral column, which is the area between the nose and the upper lip. Of course, nice, full, juicy, wide lips is a nice feminine look, and a narrower jawline that's round with a fine, round chin. So I pulled 2 pictures of some models that I think have very classic, very hyper feminine features and hyper masculine features to kind of review what I'm talking about when we're looking for facial femininity. So over here on Gigi Hadid, what we can see is a nice rounded hairline as opposed to this male model's square hairline. We're seeing a shorter forehead length between the hairline and the brow position as opposed to his longer hairline. He's got a nice full hairline. He's very lucky. But we can also see this nice arched brow in Gigi, where her brow is actually sitting above her brow bone, compared to this, where it's a very transverse brow that sits low on the brow position. Looking at her eyes, we see that positive canthal tilt, where the eye actually kind of tilts upwards as it goes out to the side. where in the male, we're seeing more of a transverse straight across, kind of mimicking what the brows do. Of course, in the male, we're seeing a wider trapezoidal shaped nose that is usually a 90-degree angle between the nose and the upper lip. Whereas in the female, we see a nice refined nose that's kind of slightly upturned. In plastic surgery, we often talk about when we look at the nose in a female, we want to see this point as a gull in flight, like a seagull taking flight. In the female as well, we're looking at nice rounded cheekbones that give off a nice round shape to the lateral part of the cheek, that blush area. Whereas in a male, it's a much flatter malar eminence, a flatter apple portion of the cheek, and more angle, a sharper angle. In the jawline, we're looking for that nice swoop with a feminine jawline that kind of tapers to a nice soft chin. In the male, we're seeing a very hard angle in his chin, in his jawline and chin. And then with that filter column that I was mentioning, it's really short in a female with nice, juicy, full lips. Of course, Gigi overdrew her lips here, but that really accentuates that feminine character. So as plastic surgeons and as practitioners, when we're evaluating patients to kind of talk about ways to enhance their feminine features, we're looking at those qualities in the face to kind of either replace tissue that's been lost over time with aging, or augmenting those areas and really kind of juicing up those areas to make them look even more feminine, hyper feminine. When we talk about facial evaluation, how we do that evaluation is typically systematic. We either do a top to bottom approach or from side to side. And we're looking at facial proportions and taking all those other key components to feminine faces in mind when we're looking to restore volume. We're looking at the skin laxity, and we're looking at how the face actually moves. And that kind of gives us our decision on how we're going to further our treatment in what exactly we need to do, because there are a lot of treatment options out there for non-surgical facial feminization. So we have to keep all of those in our mind when we're making decisions. So the first step that I think is a pretty easy one to talk about, well, this is that facial proportions I was talking about, is when we're evaluating the face, we're looking for vertical fits where each portion of that face is broken into nice equal fits. We can also see the proportions in thirds, where the upper third is equal to the middle and lower third to the face. We kind of got this picture from Queen Nefertiti. She's kind of our icon in plastic surgery for facial proportion and femininity. She had all those things that I was talking about previously. So this is kind of what we're mimicking when we're looking for facial feminine beauty. So how we get there with these treatments, I think the first place to start is with Botox. These are chemodenovators. There's lots of different brands in Botox, Dysport, Xeomin. What they do is they block the neurotransmitter from causing muscle contraction. Fancy stuff to basically say allowing muscles to relax. It allows the muscles to relax and allows the skin and other tissues around the muscle to also relax with them. This typically takes about 7 to 10 days to kick in and lasts for about 3 to 4 months. The uses for Botox are a multitude. Traditionally, we're using Botox for wrinkles around the face, but really there's so many more. And this really goes hand in hand with facial feminization, because of course it's going to help with fine lines, wrinkles around the eyes. But when we're looking at changing to a feminine face, if we need to decrease the lip show in the upper lip, we can put a little Botox in the upper lip to decrease how much tooth show we're seeing. It also enhances the lip by allowing the muscle around the lip to relax, flipping up the upper lip or flipping down the lower lip. It's also great to use in the neck and in the shoulders. These, of course, are off-label uses, but it allows those muscles to relax, creating a nice slim neckline and slim shoulders. It can relax platysmal bands from aging, kind of do mini brow lifts when we're trying to elevate brow position for that more feminine looking brow. So Botox has many, many uses. It is not just for little lines around your eyes. And it's a great place to start if you're wanting to kind of tip your toe into cosmetic surgery, to kind of start seeing how little things can affect your face with just tiny little treatments. One of my favorite things to do with Botox is for the masseter, which is the muscle in the cheek. Using Botox in that masseter can allow significant slimming in the face, giving you that nice rounded jawline that we were talking about, decreasing those hard angles, because it allows that cheek muscle to fully relax, and it really slims down the face. And that's one of my favorite procedures with Botox to be doing. Next, we can start talking about some volumization using fillers. Fillers have been around for a very, very long time. They were actually developed for HIV patients because of facial wasting syndrome, which is where a lot of the HIV medications cause the fat deposits in the face to just kind of dissolve. So these fillers were actually just created to kind of replace that volume loss. And now we're using them in aesthetic surgery to augment and kind of replenish volume. There's several different types of fillers. The most common right now is hyaluronic acid. This is a sugar-based filler known as Juvederm and Restylane. They come in so many different types of these products depending on the cohesivity. So if we want like a very natural look, or if we want a little bit more augmentation, we have several different types. So there's a lot of playing with these products that we can do to create looks that are very specific to what we're looking for. And then there's polylactic acid and calcium hydroxyapatite, which is Sculpting and Radiesse. These are more long-term products. These were those HIV products that were first developed, and now we're using them for long-term volumization in the face. They all have a little bit of different mechanism of how they work, but really the whole kind of concept is to bring fluid into that area, kind of puffing it up with your natural body fluids. And a lot of these things build new collagen in that area, which is always a very nice thing, because that prevents aging and kind of gives you that nice healthy glow that you're looking for. With fillers, we're predominantly, like I was talking about, we're looking for volumization in these areas. So we're looking to put fillers in areas that don't have volume. And that's a big question that a lot of patients are asking me, where do fillers go versus where do Botox go? So fillers predominantly go in the apples of the cheeks, along the cheekbone. We use them in the tear troughs very often, which is the area between the eyelid and where the cheeks meet, kind of where some people can have some sunken in or shadowing under the eye, and that's another place where we can use fillers. Lips is a very common place that we love to augment. Nasolabial folds, that's that fold between the cheek and the lip that forms as we age and the volume starts to sag. Of course, in the jawline and chin to kind of enhance and make that nice feminine structure. This is the predominant places of filler usage. So some nice.
So
yes.
Doctor,
yes.
We have a question, and that is, so these fillers, they create collagen in our face. Does that collagen persist over a long time, or do you have to go back for additional treatments potentially?
Great question. So collagen does break down over time. It will give you a nice collagen boost for a while. Now, the difference between how long does a filler last and how long does that new collagen build last are two different questions. So fillers typically will last somewhere around 6 months to a year, or it could be a little bit longer, up to 12 to 18 months, depending on the different type of filler we use. We have now some evidence to even show that fillers can last even longer than that, using some MRIs. This is some new research that's been coming out recently, showing that it could be even up to 2 to 5 years, but it's all very dependent on your anatomy and physiology. Collagen, on the other hand, it takes about 6 weeks for collagen to start forming with these new, with new collagen forming with these products. But that collagen can last 2 to 5 years. So you can be building a little bit of your own native tissue that is, you know, integral into your tissue, that is longer lasting than just what these products are.
And we might be getting ahead here, or you may have just answered the question, but somebody's asking if there are any more permanent options available.
Another permanent option, a more permanent option is something called fat grafting. That is not a non-surgical procedure. That is a surgical procedure, but that's also a really great procedure that is a little less invasive. That's where we take a little bit of fat from your belly or from your inner or outer thigh, and we use it in the same technique that we would use all of these fillers. That's much longer lasting. It incorporates into your tissue. It is your normal tissue, so there's no rejection. And it can be a permanent fix for some patients. But again, that is a surgical option.
Perfect, thank you.
Yeah. So with these fillers, it's a pretty quick procedure. It's typically somewhere between 30 minutes to an hour. Depending on what we're doing, how much we're doing. If we're doing a full face, you know, we're looking at a little bit longer of a procedure. There's typically not much downtime with this. There's a little bit of swelling for 2-3 days afterwards. We always tell patients to avoid things like caffeine or aspirin containing products, because that can cause you to bleed and kind of swell a little bit more. But you know, there is a little bitty downtime in the fact that you do get some swelling with these products for a couple of days. Patients usually will even like how they look while they're swollen, because they get that extra little bonus of that swelling. But as it tapers down, we can kind of see the similar product that we did at the time of the procedure once the swelling kind of dissipates. And like I said, these products can last anywhere from 6 months to a year, or a little bit longer, depending on the different type of product that you're using. So I pulled together some really nice pictures of patients before and afters. This is a patient with some cheek augmentation. So what I'm talking about here is we're looking at the malar eminence. This is where the bone, the cheekbone kind of sits here. So on this patient, her cheekbone, it has a lot of flatness right here. And we can see that because as we age, this part of our cheek, which normally sits right here, starts to descend. And it creates this heavy fold called the nasolabial fold. So one of the things that we aim in treatments with cheek augmentation is to kind of lift the cheek back up onto that malar eminence and kind of highlight that blush line. I always call it the Nike check. It looks like a check mark. And looking at her after, we see that cheekbone is very augmented. It is very, it's a much more feminine look. It looks fresh, it looks vibrant, it looks young. Following that up into the cheekbone, one of my favorite procedures to do with fillers is our cheeks. I think it's such a dramatic change for a lot of patients, and it's a very beautiful change. Lip augmentation, this is very popular right now. And lip augmentation is really a very feminizing technique because women's lips are much fuller than the masculine lip. So what we're trying to do is we're trying to enhance anatomy. Oops, sorry about that. We're trying to enhance anatomy of what you have and also give you a little bit of a juicier pout. So looking at this patient, we're increasing this negative space that there's clearly no volume, giving that nice upturn and maintaining strong anatomy. This patient already has beautiful shape to her lips. Giving a little bit more of a pout, we're trying to get a 45 to 55 ratio. That's the ideal lip ratio. So we're trying to maintain that in every patient that we're looking at. And I think that's very strong in this picture. We're trying to get that ratio perfected. If you look at her upper lip, it's significantly less than her lower lip. So using our proportions, this patient's, her anatomy is strongly outlined, and then balancing those two lips and those profiles with lip augmentation. Very beautiful lip. Like I said, lip augmentation is on the kind of the lower side of longer lasting treatments, whereas cheek is kind of the higher lasting treatment. So what I mean by that is cheeks are going to stay around for a lot longer. That's going to be that 12 to 18 month long lasting results, whereas lips can be about 6 months to a year. Jawline and chin. This is a great way to start looking at facial proportions and creating a more feminine look. Wanted to just kind of start with this bottom picture here. If you look at her jawline, it has that kind of masculine appearance where it's kind of angular in a trapezoidal shape. So looking at this, what we want to do is we want to create a nice slope in her chin and jawline. So with fillers, the fillers are injected here along the jawline and in the chin, kind of smoothing this out, giving that nice swoop to the jawline instead of an angle, coming to a nice soft chin line and back up and around. Up here in the top picture, I'm kind of showing how we can kind of restore projection and proportions with the face. We kind of want that nose, lip, chin line to be all in one little single line. We're seeing this patient a little retrognathia, or meaning her chin is kind of recessed. So I'm trying to balance that proportion, make that nice feminine shape. We're going to put a little bit of filler in her chin and kind of restore that line. Here again, we're kind of slimming down the face and the neck by adding a little bit more to in her jawline in order to maintain her structural integrity, obviously, but also give a nice slim face that is still very, very feminine and round.
And so these types of procedures with the fillers, like for example, like you mentioned that the cheeks tend to last longer versus the lips. Where does the jawline and chin fall in there?
Jawline and chin, I would say, is similar to cheeks. The products that we use for strong structural changes are going to last longer. And that's because those molecules are very tightly bound. They're very cohesive. They bring a lot of fluid into those tissues and they tend to last a lot longer. So when we're talking about stronger support areas, cheeks, jaw, chin, we're looking at a longer time. When we're looking at smaller areas like the tear troughs, the nasolabial folds, smokers' lines, and lips, we're looking at a little bit shorter of a duration of those products.
And what are the challenges involved? So, I get my jawline done, tomorrow, let's just say, and then, I come back in 18 months and I do it again, and I come back in 18 months and I do it again. Does that time, that 18-month period, does that ever expand or contract? And what are the challenges associated with getting repeated treatments?
So let's start with, are there any challenges for repeated treatments? Not so much. Sometimes we are building on top of product that is already there. So it can be a little bit beneficial to maybe even squash your time a little bit closer together. Because you're going to build on top of product that is present. You're not going to need as much product, as much of these fillers. So sometimes it can be a little bit helpful to kind of come in a little bit sooner to kind of prevent you needing so much filler. These fillers, like I said, they do cause a little bit of collagen formation. They do cause a little bit of micro scarring in areas that can be a kind of a permanent improvement in your overall look, because that's going to stay with you much longer than the product will. What was the other question, Corinne, that you had for me? I forgot it.
I'm getting old and I can't remember.
All right.
Oh, I think it was in terms of repeated treatments. Are there any challenges associated with those repeated treatments? And I think you answered that, though.
Yeah, I wouldn't say there's really challenges. Sometimes what can happen with these products, that does take me to a good spot, is that sometimes these products can migrate. they're not sitting in like a little pocket made just for them. When we're putting these products in, we're kind of tapering it to where with our eye, which is a human eye, where we think that that product needs to sit. Sometimes your muscles have different plans though, and it can push that product into various locations based on how you talk, maybe how you sleep, or things like that. So over time, you can see some product migration. Luckily, with these products, we have a very easy fix for that. It is a fully dissolvable product. We use the medication that is injected into it, and it can be completely dissolved. So it's one of the few areas in plastic surgery where we have an erase button, but we do have an erase button if we really do not like how it looks, or if we get that tissue migration or that product migration. So going forward, talk a little bit about hair removal, depilation. I think this is another very important part to kind of, when you're starting your journey or wherever you are in your journey, to consider. It's a very easy procedure to kind of tolerate. We use something called an IPL laser, which is an intense pulse laser, light laser. How it works is it selects the target of the pigment in hair follicles, and it kind of destroys that pigmentation in the follicle. It becomes a permanent destruction of those hair follicles. It can be a pretty quick procedure. It can be half an hour to an hour, depending on how dense the hair is in the area, how much hair there is. There's really minimal to no downtime. It can be a little tender as those hair follicles are being zapped. But really can go back to work later on after your lunch break when you had the procedure. Where it works best is it works on dark hair with light skin. And it's just because of that contrast between a dark hair with light skin. That's where that laser really picks up that contrast. It doesn't work so well with very fine light hair on very fine light skin. But it, it can take a couple of sessions to give results that are wanted. We can see this patient, she's got, some unwanted hair in her facial zone. After 4 sessions, we're seeing a significant decrease in that hair, permanent hair loss. That she still has some residual hair and will likely need further treatment. But this is a permanent fix to this problem. On the opposite end of the spectrum, we want to maintain hair on top of our heads. So talking non-surgically with hair maintenance and supporting the hair follicle, what we're talking about is strengthening the hair follicle. How pattern baldness works is testosterone is converted to another hormone called dihydroxytestosterone, DHT, and that weakens the hair follicle. So those hair follicles can all kind of sit in the final stage of the hair follicles, and they wind up falling out permanently. So what we're trying to do is we're trying to prevent them from hitting that final stage in the hair life cycle and falling out. So we're trying to give it as much nutrition and support as possible. So the 3 kind of mainstays that we're using currently, a newer technique is called PRP, platelet-rich plasma. This is where we take a little bit of your own blood. We separate the plasma stem cells from the rest of the blood product, and then it is injected or microneedled into the scalp to kind of ensure that you're getting enough nutrition into the base of the follicle. A little bit of a downtime with this. You're looking for kind of a longer procedure timeline. You're getting injections every 2 to 4 weeks for about 3 months. This is what the biggest paper that we have right now says on PRP, in how it is improving hair strength. And then after 3 months, you're probably going to do this every year or so. Some people have different types of treatment strategies for this. But typically it's about a 3 treatment step that needs to be repeated yearly. It can be a little bit painful. Typically we do some numbing medicine into the hair, hair-bearing scalp, and then do the procedure. The procedure can take anywhere from 30 minutes to an hour.
And do you have, is it okay if you have longer hair with that type of treatment?
Absolutely. Absolutely. I'll show you on my next slide. The patients that I have are all females with longer hair. And this is strengthening those hair follicles at the base of the hair. So as the hair grows, it's going to continue to thicken because it's maintaining the whole structure of the follicle as it grows. So it is okay to have long hair with this. It works just as well. Our 2 other non-surgical treatments, these have been around for a very, very long time. Minoxidil, which is actually an anti-blood pressure medication. We use it topically, and it causes the blood vessels around the hair follicles to kind of engorge and kind of swell. So that brings all the nutrition, kind of similar mindset with that PRP, right? You're bringing more of that stem cells and nutrition to the hair follicle to strengthen the hair follicle. With minoxidil, it is a daily use medication. As if once you stop using minoxidil, it does, you know, kind of return to its normal situation. So it is something that is going to be daily for, you know, probably life, to maintain strong, healthy hair. The third option is finasteride. This is a 5-alpha reductase inhibitor. It is anti-androgenic in that it blocks the conversion of testosterone to that naughty hormone DHT. It does come in an oral or topical route. Oral route can increase circulating endogenous testosterone. So it would be something that you want to talk to your endocrinologist about, just to make sure that it's okay with any hormones that are being used as well. But it does come in a topical solution, which can be actually mixed with minoxidil. And that's probably the best way to be having both of these medications, because they stay localized into the scalp. They are not going into your blood system and changing hormones inside. So a really good kind of treatment with maintaining hair support on top of the head is kind of a mixture of all 3 of these. You want to talk to people who are very well knowledgeable about hair maintenance and support. Not every plastic surgeon is going to give you the same sort of spiel when it comes to this. So you do want somebody who has a lot of experience with maintaining some hair. Just wanted to, these are some actual patients who are PRP patients. So this is that platelet, that blood product that we're using to, it does not stimulate new hair growth, but it strengthens the hair that you have. So the hair follicles literally become much thicker, and as they grow out, you can really see a significant change in the quality of the hair, making it appear that you have more hair. Next, I want to talk about some non-surgical face lifting procedures. I think Instagram has kind of made threading very, very popular recently. These are slowly dissolving stitches, basically. They last for anywhere from 6 to 18 months, depending on what type of material that's used. We use it in very specific places to kind of resuspend tissue that's either dropped or we're trying to augment. It's best in very, very small locations. On Instagram, we're seeing a lot of people use these threads just all over the face and trying to put in 20 or 30 of these to, you know, give you a non-surgical facelift. They don't work very well like that. They work really, really well when you're trying to get a change of 2-3 millimeters. So they work really well in areas like the brow position, or at the jowls to kind of tighten the jowls, or in the neck. This is a very quick procedure, about 30 minutes to an hour. Again, no downtime with this, just a little bit of discomfort from where the needles are replaced. We usually give a little bit of numbing medicine prior to this, but again, this is what I call a lunchtime procedure. You can come in on your lunch break and go back to work an hour later. It's made of 2 different types of threads, more common, either the PDO threads, this is probably the most common right now, or the PLLA threads. Like I said, great areas to use them are where we're trying to improve, or we're trying to lift something up 2 or 3 millimeters. These do cause collagen to be stimulated in those areas as they break down. So we're resuspending, and you're going to get a little bit of that collagen boost that's going to kind of plump that area up a little bit more and be a little bit longer lasting than the product itself. Here's, I think, a very good picture to show how this is where it's most effective, is when you have a minimal change that you're looking at. Where in this patient, we're looking at a little bit of a jowl forming. So we're losing the contour of her neck. We're losing that nice feminine roundness to the shape of her jawline. You can see even, with her aging, her oral commissure, where the corner of her mouth is starting to angle downwards. So strategically placing threads in this lower jaw can kind of resuspend that tissue and give that nice soft jawline that we're looking for. And then this is a very, very minor change, but this is a nice important change for a patient other than doing a full facelift. We're talking about elevating this oral commissure, very small degree, but it's enough to make a more rejuvenated appearance to her face. Going down into the face further, we're now looking at the neck. There are some really great non-surgical tools that we can use for kind of sculpting and tightening the neck, giving a nice smooth appearance. A lot of people are born with a little excess fat pad that sits above the platysma muscle. The platysmal muscle is that strong web-like muscle in the neck. So we have some great tools to kind of reshape and make the neck nice and tight with decreasing our aging, decreasing some fat pad, and stimulating new collagen. One great treatment is alt therapy. This is an ultrasound. Think of like an ultrasound when you're looking at for a pregnancy for a baby, same sort of situation. We're using ultrasound guided waves that are going to hit the deep dermal layers of the skin and kind of vibrate them and produce new collagen. It's a very quick procedure. Again, it's another 30-minute to 1 hour procedure. There's no downtime, very little swelling. It usually takes about 6 weeks to a couple of months to kind of start really seeing the tightening. And that's based on the timing of new collagen in the skin. So there's a little lag to the actual result with alt therapy, but they can be very, very significant. And those results can last up to 2 years. So it's something that can be done every 2 years. And it can be done on the neck, it can be done on the lower jaw, and up even into the cheeks, really producing tightening of the skin. Another very popular product that's been around for a very, very, very long time is deoxycholic acid. This is Kybella. So for patients who have just that little extra fat pad underneath the chin that we're trying to kind of reshape that jawline, give that nice feminine jawline, we want to get rid of that fat pad that's sitting underneath there, kind of giving, losing the nice curvature of the face. This is an enzyme that is injected into those fat cells, and it actually bursts those fat cells. This procedure does have a little downtime. There's about a week of swelling associated with it. It's once all that swelling goes away, you're absorbing those fat cells and you excrete them out. It's very, very good for small areas of stubborn fat. So like that little area underneath the chin, it can also be used in bra fat areas or underneath the butt to kind of get rid of those small little areas of fat. You don't want to do it if you have any skin laxity because it can worsen skin laxity. And the other thing with Kybella is it may need multiple sessions to kind of see the results that you really want to get to, but they are permanent results. This is the result of some alt therapy. So even though we do see a little bit of a fat pad in this patient, it's enough collagen stimulation to get a nice angled jaw here that's nice and round and reducing that extra fat pad. Again, with how it works is it's kind of creating new collagen, tightening the skin around the jawline so that we can really appreciate the nice feminine jaw structure in the lower third of the face. Same thing, this is a younger patient with a little bit of skin laxity where alt therapy works extremely well. Kybella, these patients may have had a couple of treatments, but it really reduces the excess fat pad in that lower submental region non-surgically. We're just injecting a little enzyme into those areas and recreating a nice shape that, you know, making your face look slimmer, making your neck look slimmer, and enhancing the contours of your lower third of your face. The last and most important part that I think is very important to talk about is skincare. You can do all of those other procedures, but if you are not taking care of your skin, you are not giving your face what it needs to perform its absolute best. So skincare is a vital part of what we do in aesthetics, in maintaining a nice feminine face. A daily regimen is definitely the key to excellent skin results. What is very important with that is it does need to be tailored to your skin type. Acne-prone skin is very different than what is needed for dry skin. So having an esthetician who kind of knows exactly, who knows your face, knows you very well, is going to change how your skin looks on a day-to-day basis. We do know that there's, you know, a couple of things that we need to maintain a very good daily regimen. That's a daily facial wash to kind of debride and clean out our skin and pores. We want to do this not in the shower, not in hot water. Typically want to do this in cooler water outside of the shower. We don't want to have big open pores and that can become clogged as soon as you walk out of the shower. Using a toner, a moisturizer, and my favorite to tell every patient is SPF. You want some sunscreen that is zinc or titanium based, not just copper tone. You want something that's actually going to be reflective of the sun rays. And that's something that's going to be either zinc or titanium based. So just check your sunblocks. That's going to be a huge key. That's why everyone in Hollywood still looks the way they do, is they are using some sunscreen. And then a retinol. This has been around for a very long time, and we know what it does. It produces new collagen. You can hear the key word on tonight's discussion is promotion of collagen. Tretinoin works to kind of turn over skin cells. So it's producing new collagen, new elastin in the skin. It can actually be preventative for skin cancer and actually treats very early skin cancers. So it's a very great product, but it does need to be used properly. So you do want some professional opinions when you're talking about using a tretinoin or a retinol. So the daily regimen is going to be your daily cardio for your skin. It's going to be the most important part of maintaining healthy skin. We can always add little lasers and peels. There are so many types of lasers and peels on the market right now. Again, aimed at building new collagen, retexturing the skin, and dealing with pigmentation. We can fully get rid of acne scarring, reduce those little fine lines and wrinkles around the face, get rid of rosacea and melasma. So that being said, all of these little treatments that I've talked about, they can all be very tailored to what you need, but it's very important to be taken into consideration what your desired outcome is, what your view is in your mind of what your face should look like. So when you're looking for someone to give you these recommendations, you want to find someone who's going to listen to you and what your concerns are. Don't just go to someone who's going to give you the same face as the girl in front of her. You want to make sure that you have a nice personal relationship with your providers. because once they get to know you, they're gonna know exactly what you need. Want to give couple little pictures of that skincare here. Up here, we're seeing some acne, some yeast formation. Just medical grade skincare can really take care of that with just topical skincare. Skin discoloration, actinic damage from the sun can fully be reduced with just some medical grade skincare and some light lasers. Freckling, same situation. Same freckling here, melasma and dark pigmentation in the skin, and even these little telangiectasias, these little blood vessels around the face can be fully zapped off so that you have nice, clear, beautiful skin. I wanted to throw this little slide up so that you guys could screenshot. Has my email address and the Instagram of me and my awesome team. The pictures that I showed tonight are many of their pictures, and I'm very happy that I have some of the most amazing team members in our practice. They're all extremely talented. So you're more than welcome to reach out to any of them if you have any questions regarding anything I said tonight. They're all wonderful people. And that's it.
Perfect. So somehow we lost your video. There you are. You're back.
There I am.
All right. So we lost you there for a minute, but we heard you. So that's perfect. So we're going to give people a moment or two to ask questions and see if they have anything else they want to share. In the meanwhile, I really want to thank you for your time and really appreciate the investment that you put together in getting ready for this program.
Absolutely.
So please, just to remind folks that you can ask questions in the chat or make respectful comments. We'll do our best to get Dr. Regan to answer them. So here's one. Regarding male pattern baldness. So what are the most effective and what are the most cost-effective treatments?
So male pattern baldness, this is where I was kind of going with those non-surgical treatments. Those are going to be aimed at maintaining the hair that you have. So it's going to prevent further hair loss. So that is a very important first step when we're talking about maintaining hair and male pattern baldness. Male pattern baldness is typically here in the crown of the head. So this is where it's all really aimed at. Once we have that, if you already have significant loss like I do, maintaining is important, but replacing is another option. That is a surgical treatment. That's where we remove some hairs all around the back of the head and replace them into areas where there is no hair. Still, that is a permanent movement of that hair. Those hair follicles usually last for the rest of your life, but you can continue losing the hair that you already had in that area. So you still need to do some maintenance work after procedures like that are done. Doing hair transplantations come a long, long way. We're not doing big strip hair transplants anymore. No. My husband himself has had 2 treatments of hair transplantation, and you can't even tell where the hair was taken from. So it's come from a very, very long way and very good treatment, but it is very costly. So your most cost efficient to answer that portion of it is to maintain what you have, try not to lose it. So, and that's going to be with that topical minoxidil or topical finasteride, and then seeking some PRP.
So for somebody who's, follically challenged, like myself, right?
Yeah.
So I'm good back here, but I had some recession, right? And the only solution for that is really some sort of surgical procedure.
Correct. Correct.
So next question is do you have any recommendations in regard to electrolysis or laser or IPL for hair removal?
Do I have any recommendations on where to go or?
Sorry, and in terms of efficaciousness.
The efficiency of it. So it does kind of go back to how the laser works and what your anatomy is. So like I said, the laser is targeted at darker pigmentation in a lighter field. That's just how the lasers work. So it zaps that pigmentation, destroys those cells. So if you are someone who has light pigmented hair and you're fair skin, it's not going to work as well. So you just have to kind of stick with it. If it is a darker hair in a lighter skin area, it should resolve pretty well. And then once you also start taking your hormonal therapy, that's going to also start improving unwanted hair as well. So you just want to find the right person who's well trained with electrolysis and laser hair removal. Not just any Joe Schmo can do it effectively.
Yeah. So for myself, for example, when I started my transition, my beard was, like 40% gray or white, and laser did a great job on the dark hairs, and they were all gone for the most part. But I am doing electrolysis for the white ones, which is such a joy.
Very stubborn. It's very stubborn.
So here's a question. Somebody who's had FFS and they have an indentation under their chin from a trachea travels incision. Would fillers work to smooth out that type of a scar?
That is off-label, but yes, it can absolutely do that. You want to look for a filler that's going to be very soft. You don't want a heavy filler in that area. You don't want a lot of fluid. You're just trying to ease that scar. With time, you can actually improve that scar completely. You could, pop that back to a flush line in your skin, because how scars work is if you put something in between the scar and the native tissue, it breaks that scar open a bit. We often will even fat transfer, that same procedure that I was talking about, moving that fat up into the cheeks. You can put a little bit of fat in that underneath that scar as well for a more permanent result. Perfect.
So there's a question here regarding to trans men or trans masculine folk. Do you do work with trans guys to try to masculinize their features?
Oh, absolutely. We work with trans men to kind of, again, give that nice angled, harder jaw that is very masculine. A very popularized kind of thing right now is what we're calling the bicycle seat face. This we classically see this with Brad Pitt's face. He has very chiseled cheekbones, very hollowed cheeks here, and then a very nice angled jaw, very, very angular proportions. Timothy Chalamet, Pete Davidson, these are masculine bicycle seat face sort of shape. So that's a kind of what we're really seeing right now in social media, how people are really wanting to look. But fillers can improve that by kind of bulking those areas, that upper lateral cheek, jawline, and in the chin. Absolutely.
Great. And we have another question around, do you have any thoughts on exosome therapy for hair loss? I'm not even sure I know what that is.
I don't think I personally have any thoughts on it. I'd have to do a little research to give you an expert opinion on that. Right now, I don't have any opinions on that.
Can you tell us what it is?
I can't. Okay. I'd have to research what that is.
New and exciting.
New and exciting.
All right, well, we'll give people another moment or two for any final questions here, but I think we're coming down pretty much to the end.
Awesome.
Would you like to share the website for your practice at all?
Yeah, I can. The website is modernaestheticplasticsurgery.com, and it's a mouthful. Modernaestheticplasticsurgery.com. That's our website. You can Instagram us. We are very responsive with our Instagrams if you have any other questions. We're all linked to each other as well, and we all have different, specialties within our group. So if you have certain information that you're looking for, find the right person in our group, and you can chat with them. This is a lot of information. It's that we just reviewed, and it's really based on your anatomy and what you have. So not everything is for everyone. So you definitely need a little bit of a one-on-one counseling to kind of give you the best results that are right for you.
Okay, so somebody said they have a clinical question they'd like to ask you, but they want to do it via email. So could you share an email address?
Sure, it's Regan, so JREGAN at ma-ps.com. So jregan@maps.com.
Perfect. Well, with that, I think we will bring it to an end. Dr. Regan, it is such a pleasure. Thank you so much, and we hope to have you back sometime soon.
Thank you so much. It was a very huge pleasure. Pleasures all night. So everyone have a wonderful night.
Thank you. Bye-bye, everybody.
Bye-bye.